Welcome to Face Crime Skin Lab podcast. Today we're going to talk everything hormone health and how your hormones play a huge role in not only how you feel, but also how you look. So we're going to talk health on an endocrine level. I'm very excited to invite my guest, Chloe Logan, to discuss everything hormone health and gut health. Chloe Logan is a trauma-informed counselor as well as a clinical registered nutritionist. She entered the world of counseling after years of working as a nutritionist in her practice, The Rooted Method. Now, The Rooted Method helped her clients get to the root cause of their issues, especially when it came to gut health, gut issues, so think maybe constipation or hormonal imbalances, think painful periods or even absent periods. So she worked one-on-one with clients looking at the root cause. Chloe now focuses her practice in counseling where she looks at trauma, shame, attachment, and how those things can manifest physically. So how emotions can actually cause physical manifestations in the body. The discussion in this podcast is for general information purposes only. It is not intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you have regarding your medical health. Never disregard professional medical advice or delay in seeking treatment because of something you heard on this podcast. So let me introduce Chloe and welcome to our podcast. We are so grateful to have you on today.
I am so thankful to be here. Thank you for having me.
Awesome. Okay, so you tell me a little bit about your practice and what you're doing now, because I know that this is a new adventure for you, the counseling avenue. You've always been a counselor when it comes to nutrition, but you're doing a lot more, would you say, psychosocial work, more one-on-one with mental health. Can you tell me a little bit more about it?
Yeah, definitely. So the whole reason I moved into the mental health realm was working as a nutritionist. You experience a lot of things that are not nutrition related that impact your client's choices around food or desires for certain types of food. And there's a lot of emotional aspects that go into fueling our body and also feeling well in general. So transitioning into the counseling realm for me was a way to get further into the roots of what's impacting someone's wellness. And the reason that I decided to go into more of a body-focused somatic type of practice, as well as work with trauma, is keeping in mind that trauma is not exactly just something that happened. It's the way that the body holds on to the emotional experience of what happened. So oftentimes we see physical manifestations of trauma or attachment wounding challenges with individuals' parents as a kid and growing up, and then their perceptions about the world start to show up in their body when they're adults, or that can even start from childhood. So really in my work right now, I'm working with my clients to look at their belief systems, to look at the way that they really view the world and how that's going to impact some of the choices that they make on a day-to-day basis.
Neat. I'm noticing that there is a lot more recognition around the fact that emotions, although it's something we think we can't measure because we can't really measure it yet in a physical form, do in fact cause physical ailments, right? So I know that in my practice, for example, like I have somebody I refer to osteopathy work because, for example, when they have trauma, they harbor it somewhere in their body and then osteopath goes in there and moves things along and helps open things up and clear out old emotional damage that's caused physical pain. So there is a lot more awareness around this. Now, that's one tool I use for my patients. What do you use in practice? What are your tools? Is it online? Is it in person? Is there physical work? Can you tell me a little bit about that?
Yeah. So within the counseling realm, I work fully online. And I take an integrative approach. So I weave in different types of modalities because when you, similar to naturopathic medicine, when you have a patient in front of you, they're not just one type of blueprint that you can put a certain modality on top of and then say, okay, check mark, we're going to see results with this. surface.
Mhm.
People are complex.
Mhm.
And so I weave in parts work, I weave in somatic psychology, I weave in dialectical behavioral therapy, which I always trip over that word.
Okay. You're going to have to explain to us what that is too.
Yeah. Okay. So I'll start from the top. So parts work is really looking at the personality as a multiplicity. So examining the challenges that we have on a day-to-day basis and looking at the different aspects of them as really actual parts of ourselves. So for example, if you were working with a client who had an eating disorder and they had binge eating disorder, the part of them that brings them into therapy is likely not the part of them that binges. The part of them that brings them into therapy is the part that wants to make a change, the part that is worried about the fact that they are binging. And then the resistance might come from the part that is binging because there's a reason that that is happening. So that might be a soothing mechanism. That might be to avoid emotional pain. So those are really two separate things. If we treat them as one thing, we can run into some roadblocks with people because on one hand, we want to make some changes. And on the other hand, there's likely a very valid reason why we are not making those changes. So we separate those things and we look at them individually. When it comes to somatic psychology, somatics is a pretty broad term. Essentially, it just involves looking at the connection between the mind and the body. So in a somatic session, a client might say something like, I am really having trouble stopping binge eating. And so you might say, okay, tell me a little bit about how you feel when you binge eat. And so they go into describing how they feel and what happens there. And then you might say, when you talk about that, what do you notice in your body? And there might be a sensation that comes up. So maybe that is some tightness in the chest. Maybe that's a lump in the throat. And really, you're getting them to feel into that sensation and learn a little bit more about that sensation.
Okay.
There's 5 different channels that you really look at in somatic psychology. So you look at sensations and imagery, you look at the meaning making, you look at the affect, which is the emotions, and you also look at behavior. So somebody's saying, oh, I'm so mad at myself when I binge eat, and they might clench their hands really, really tight. You might lean into that. So you might say, well, there's some energy in your hands right now. What do your hands want to do? And so one exercise I might do with a client would be grabbing like a towel or a blanket and wringing it out as they are talking about that and just channeling that energy. DBT is a therapy modality that was developed for borderline personality disorder, but it is really helpful just in terms of supporting clients with their distress tolerance. So it's looking at emotional regulation, it's looking at interpersonal effectiveness, which is fancy way of saying how people communicate with one another. It's looking at mindfulness, and then it's looking at building skills to help increase our capacity for stress. So I layer the practices together because for some people, going into the body and recognizing bodily sensations is really overwhelming. So we don't really start with somatics. We would start with maybe distress tolerance and giving them skills and tools to work and live in the world and maybe make their environment a little bit more supportive and safer for them. So then they feel able to go into the body and work with some of those deeper emotions and even traumas if we get there.
So what I really appreciate about you having all those tools and methods are, and I think, our audience listening, it knows that not one thing works for everybody. So I find that very, very creditable to you and your profession that you can offer different forms of treatment and that you're a people person. You listen to cues, you obviously observe them, like you said, with the clenching of the hands, right? And just being able to read people and understand them, you can apply different strategies to help them heal, which I think is awesome. And I think it's really good to have a lot of tools in your toolbox because that's only going to help you help so many more people. Now, one of the main reason I wanted to bring you on today is because my passion is helping women, men navigate the health of their hormones. And this is something that I know you use in your practice. You are very well versed with hormone health, and it's important. It's important, especially everything face crime, right? We talk health and beauty. And I really want to discuss how we go about treating patients, clients, and the health of their hormones and how it plays such an important role when it comes to their healings, their healing. So can you tell me a little bit about how you implement this into your practice when you see a patient? And is it with every single patient that you address hormone and gut health, which I mean, the two are intertwined, but tell me a little bit about that.
Okay, yeah. So as a nutritionist, I like to describe things as a bit of a pyramid to my clients. I think working with a phased approach similar to counseling is really helpful because when you build a really strong foundation, oftentimes the things that are manifesting at the top get resolved on their own. And if not, it's a lot easier to address those things. So, what I would say is the foundation of the pyramid is your stress and your nervous system and your environment. The second level of the pyramid would be your gut health. And then the third level of the pyramid would be your hormones. And I mean, it's a pretty one dimensional idea to think of it as a pyramid because they're all interconnected. Our hormones impact our gut, our hormones impact our stress impacts our hormones. So it is actually quite circular, but sometimes isolating things out and focusing on one thing at once can be really helpful for not necessarily taking on too much because that can cause a lot of stress. So oftentimes with clients, when they first come to me, if they are struggling with a really painful period or if their digestion is really up in the air and they don't know if they're going to be able to go to the bathroom one day or not the other day, and it's very disruptive to their life, we'll focus on what's going on in terms of your stress and how can we maybe create a little bit more support and regulation in your system. So then when we move into interventions, like maybe introducing something that could be really challenging, like an elimination diet to support the wellness of our gut, it's a little bit easier to do those things. So first things I would start with would be looking at how fast we eat our food and how calm we are when we go into a meal, and potentially integrating in practices that I've learned from counseling that can be really supportive for regulating the nervous system before we start even putting food in our mouth. So one thing that can be really helpful for a lot of people would be something like bilateral stimulation. So when you go to sit down for a meal, ideally we can have a meal seated. You can give yourself a little self hug, and then you can just do a little tap left and right on your arms. It works on your thighs too.
Okay.
Yeah.
And what's this doing exactly?
Yeah, so this is basically just stimulating the different sides of your brain,
Okay.
and it's also helping to support your vagus nerve. So it's prepping your body for
love this.
food.
Okay.
Yeah, it's activating your parasympathetic nervous system.
This is so great. So
Yeah.
this helps me. I have like a mindful eating handout that I give my patients, and this is new. Thank you.
Yeah, that's a great one. Because when we go into a meal, when we talk about supporting digestion, it all starts before we even put our food in our mouth. If we're in a very stressed out state, all the things that we need to have proper digestion aren't necessarily, you can think of them as turned on. So we're not producing enough gastric juices. We're not going to be able to move food through our system at a rate that's supportive. We're not going to produce enough bile. And so that's what can create an environment for dysbiosis and bacterial overgrowth. And that's what can create the gut issues. So we just go back to the beginning. We work on the things, the mindful practices around eating before we even get into, hey, let's change your food.
And it happens so often. I would say in 99% of my patients with GI upset or hormonal imbalances, do you sit down and eat your meal with either your loved one or by yourself with no distractions? And so often, no, we don't mindfully eat. And I always, I point to the teeth. We have canines for a reason to really chew through that food. We have saliva. We have, like you said, it starts before at the sight and the smell of food. We're literally releasing those enzymes and that digestive juices, like you said. So mindful eating is so important, and it's free medicine. It's going to be the quickest thing to help heal the gut, especially if there's stress on the gut. So I'm glad you practice that, because that is something I strongly believe in and I introduce in my practice, because we all eat on the rush and it really does hurt us.
Yeah.
And then you have a gut dysbiosis, which then leads to hormonal imbalances.
Exactly.
So, okay. You touched a little bit on food sensitivities. Now, this is also a hot topic, right? Because everywhere you go, you're seeing on the menu now nut-free, gluten-free, dairy-free. And there is a definite difference, which we can talk about, between food allergies and food sensitivities. But just because we're at that foundation part of the pyramid you described, let's keep talking about gut health and elimination diets and whatnot. So if we take care of maybe like the mental health and the calming around mealtime and reducing stress levels, how do you go in on gut health after that?
Okay. So the first thing is I always take from my client what they are already really aware of. And a lot of people are aware of the fact that when they maybe eat a certain food, they don't feel the best. They'll say, yeah, whenever I eat ice cream, 2 hours later, I feel like my stomach is in knots and it's cramping and it's really, really painful. So we start with that. We start with, hey, what's triggering you and what do you know? And then we see if some of the symptoms will be reduced by reducing some of those really known triggers. If a client's unaware of what some of those triggers are, there's certain things that can be more triggering than not. I would say leaning into more of a whole foods diet is a great place for most people to start, and removing more kind of packaged processed foods before we say, okay, I'm going to fully eliminate like gluten, or I'm going to fully eliminate dairy, just because you're likely going to get a little bit more nutrient density from whole foods, and then you're also not getting all of the additives that are in processed foods as well. So to kind of loop back to your question of what do you do with an elimination diet? Really, the idea is that we want to lower inflammation and we want to make sure that an individual's feeling good, because the better that you feel, the more that you can add in and shift and change. So typically by reducing our exposure to things that don't make us feel well, it makes it easier to do steps down the road. So we would do an elimination diet, but really it's only intended for a period of time. I think that it's really important to have balance, to be able to go to a family dinner and have dinner with your family.
Have the ice cream afterwards.
Yeah, have some ice cream and not have to worry about it causing your stomach to cramp up and you being in pain for the rest of your night. Connection is incredibly important for our wellness and our health and our gut and our hormones. So if food is a vehicle for connection, I think that that's great. So we would want to look at, okay, we can do a little bit of an elimination diet, but what's actually making you sensitive to those foods in the first place? So do you have dysbiosis? Do you have small intestinal bacterial overgrowth? Is that why every time you eat anything that basically has fiber in it, you feel like your stomach is bloated for 2 hours after that? The idea with an elimination diet is not that we do it for the rest of our lives. We use it as a tool, and then we move into the next phase.
Okay. So just for our listeners, SIBO is short for small intestinal bacterial overgrowth. What that is when we have bacteria, which bacteria are on us and in us at all times. There's more bacteria than there is human cells. So they are part of who we are, but most of it in the gut reside in the large intestine. Now, when that bacteria make their way up into the small intestine, it could be problematic. And things we see with clients and patients are bloating, big time bloating, sometimes waking up bloated even, but mostly after meals, discomfort, sometimes burpee repeats, acid reflux. A dysbiosis is an imbalance of bacteria in the gut. So we have healthy bacteria, we have pathogenic bacteria that can be problematic, and those problematic bacteria can sometimes, there may be a little bit of an overgrowth. And so we have what we call in practice a dysbiosis, meaning that we have to balance out the healthy and the bad bacteria again. So that's also something I'm sure you're noticing more and more people are becoming aware of. I know in naturopathic medicine years ago, ulcers, we were telling them ulcers is not stress. Like, I mean, stress again affects the health of the gut, but we were saying ulcers are a bacterial infection and nobody would take us seriously. And we were treating H. pylori with antimicrobials, which now we know ulcers are an overgrowth of H. pylori. H. pylori is a type of bacteria that can be very problematic, and if not taken care of, can lead to things like stomach cancer. So it's finally, I feel like, science and medicine are catching up and recognizing the importance of treating these gut dysbiosis. And so I'm glad that you're doing that, because the gut is the foundation of the pyramid, right? It does connect to everything. So let me lead that into my next question. How does gut health affect the health of your hormones? It's a big one, but yeah.
It is a big one. I would say if I had to narrow that down, our gut health impacts the way that we absorb nutrients.
Definitely.
So if you have dysbiosis in your gut, or if you have a lot of inflammation, it's going to impact the way that your body is going to uptake all of the vitamins and minerals from all of the lovely food that you eat. So it doesn't necessarily matter if you're eating the most nutrient dense foods or if you're having the perfect ratio of vitamins and minerals at every meal. If there is damage internally, then that means that all of those nutrients that help to support our liver and detoxification, as well as plump up our skin and help our eyesight, literally every function in the body, right? We're not getting the full impact of all of those nutrients. So you're either having them sit in your body and they're not being broken down and you're experiencing constipation, and then you are just flushing them out when you finally have a bowel movement, or they're just going right through you. So it's the lack of nutrients that I think is so huge when it comes to supporting our hormones, because our hormones are created from the things that we eat.
You specifically talked about how the impact of food and absorption in the gut plays a big role with the function of these hormones. Controversial topic to some, not all, but making sure you're absorbing and getting good quality foods, going back to the whole food diet, but how important cholesterol is. And cholesterol comes from animal products to help build the health of hormones. So I don't know your stand on this, but I do struggle with patients that do have more of a, especially vegan type diet where there's no cholesterol in there at all, because that's what builds our sex hormones. That's what builds estrogen, testosterone, is needing that, along with nutraceuticals and nutrient-rich foods to help with the function of our hormones. So what are your thoughts on different lifestyle interventions, for example, vegan, vegetarianism, heavy animal-based?
Yeah, so there is so much coming out in the way of understanding how our genes impact the way that our bodies absorb nutrients. So I think one point that is really important to drive home here, even if you are choosing a diet for ethical reasons, that might be the way that that diet serves you, and it also might not serve you nutritionally. So you might be an individual who really, really struggles to convert certain fatty acids to forms that are more beneficial for our sex hormones. So you're getting all of your fatty acids from plant-based sources, and then that conversion process is really stilted in you. So even if your morals are aligning with maybe not having an animal-based diet, your body might not be aligning with your morals, which is really challenging for some people because there are very emotionally based reasons why people might choose certain types of diets to support them. So I think that that's a big conversation. It's looking at how do you feel on a day-to-day basis, and are there maybe some concessions that you are open to making in order to support your wellness? Funnily enough, I grew up with a dad and a stepmom who were both vegan.
Okay.
My stepmom is someone who thrives on a vegan diet, and she does really well. And she feels energetic, she feels calm, she feels regulated. She has thrived in that lifestyle for about 13 years, I would say. My dad, on the other hand, lost a lot of muscle mass. He started to experience some brain fog. He also started to notice patches on his skin show up, which he then connected to a vitamin A deficiency. So he's one of those people of the population who can't turn plant-based types of vitamin A into the active form that our body would use. And then he had to go and get those things lasered off. When he started supplementing with cod liver oil, he noticed that most of the skin issues he was experiencing went away. Yeah.
Okay, that's interesting. I used to be a vegan.
Okay.
Years ago, I was 23 when I started vegetarianism, and then I started eating as a vegan, and that was actually the demise of my health. That was when my hormones, my thyroid ended up going out. I got diagnosed with Hashimoto's, which is an autoimmune thyroid disease, and props to your mom who's doing a great job at it. I know a lot of vegans that do a good job at it. I wasn't.
Yeah.
I was doing the processed food. I wasn't doing organic soy. I was eating a lot of things out of packages, which at the end of the day, eating processed packaged food is going to be horrible for the healthier hormones. But yeah, it was very quickly that I figured out how to, I did it for a couple of years and my health declined. So once I started eating meat again, and I do have a very whole foods, animal-based heavy diet now that works for me and my hormone health. I'm very with my insulin, I actually I'm a fainter.
Okay.
I'm one of those. I'm a fainter. I need to have heavy protein consistently. But yeah, it definitely impacts my hormone health. So there is a way to do it, and there is a way to do it correct. Works for some people, not all people. But again, that nutrient support, having healthy gut, absorbing things through your gut to build up the rest of your body is so important. And I think that's why the gut is the foundation of your pyramid. So
yeah, absolutely.
I appreciate that. So gut health, foundation of absolutely everything when it comes to feeling and looking your best. Now, one thing I want to discuss, because I'm bringing it up often in practice, so I can only imagine you are too, but female hormone health. And the reason I want to talk on this subject is because I don't think a lot of people, especially young women, understand how much the fluctuations throughout a monthly cycle affect A, our mood, and B, how we feel and look about ourselves. So can you tell me a little bit about that and how you address that and provide education? Because there are so many up and downs, and making patients aware of that is super important.
Yeah, great question. I think awareness is the first place to start, is the education of you will not likely feel the same every single day throughout the month. And that even in itself can be kind of like a bomb dropping for people. Like, oh, wait, it's normal to not feel the same every day. Like, there's a reason for why I notice that my moods shift and change, and there is. So that's the first place. It's just starting with, hey, things are different for you. And the world is built in a very monotropic way to support not necessarily having those shifts and changes on a day-to-day basis. That's a whole other topic that we could get into. But throughout the month, our hormones are shifting drastically. So if we think at the beginning of our menstrual cycle, we have very low amounts of hormones. And so oftentimes that's when we are bleeding, and we will notice that we maybe have a little bit lower energy. We'll notice that maybe we are a little bit more sensitive. We will notice that maybe we have more cravings, and that can also be connected to our emotions and our mood, because our mood can fuel what we use to soothe ourselves. And because we have lower amounts of hormones, we will also notice changes in our skin, which you could probably speak to much more than I could. But oftentimes we'll look at ourselves and we'll feel like a little bit more lackluster, a little bit more drab. We might notice our skin looks a bit more dry, our wrinkles are more prominent. And then as we shift into the phase of our cycle where our hormones start to increase, and we get ready for the middle part of our cycle, which is ovulation, which is, for people who don't know, the time of the month where you would be able to get pregnant. we will notice that our skin will start to look a little bit more plump. It'll be a bit more juicy. We might even notice that our breasts start to swell a little bit. And you can think of this as ways to attract the opposite sex so you can make a baby, right? Your body knows that you are getting ready to have your egg drop. And so it's essentially, it's kind of like birds in the wild when they've got all those bright, beautiful feathers. They're like, hey, come look at me.
Showing off.
Showing up, yeah. So you'll notice your skin will be more plump and you'll likely have a little bit more energy as well. And then as you move out of ovulation, this can be a little bit different depending on the person and depending on where your hormones are at. Naturally, if your hormones were quite balanced and everything was quite regulated, you would start to produce more progesterone. And progesterone is actually quite anti-anxiety. So we likely wouldn't experience a ton of anxiety or really drastic mood swings. We might feel a little bit more chill, a little bit more calm.
Better sleep.
Yeah, more rested. We naturally will likely experience a little bit more hunger because we burn more calories and our metabolism increases at this phase of our cycle right before we start and have our period again. However, if an individual has imbalanced hormones, this is really when PMS will start to kick in. And instead of maybe noticing that you are slightly puffy, you'll notice that, whoa, I feel like I gained 10 pounds overnight and my skin feels like it is heavy and I feel very swollen. You might notice that you have drastic mood swings, a lot of anger, a lot of anxiety. If you are low progesterone, for example, because you don't have that regulatory hormone to balance you out. Also will experience usually really intense cravings and oftentimes cravings for sweet food, salty food, things that are going to make us feel really good and help to support anxiety. And at that phase in our cycle, we're also producing a little bit more oil in our skin. So that's normally when people will start to experience hormonal acne. But I would love to hear a little bit more in depth on the things that you know about specifically the skin in relation to moving throughout your cycle.
Of course. I want to point out, again, going back to the gut connection and the importance with hormone health, those cravings, something I learned years ago, which I thought was so neat, but leading up to the first day one of your cycle, so your PMS, I always ask my patients about their cravings, right? So if they have a salt craving, right, they might have a little bit of what we call adrenal insufficiency, right? So that salt actually will help bring up their blood pressure. But chocolate, we hear chocolate all the time. I'm sure you know this
Magnesium.
one, but chocolate is magnesium.
Yeah.
So a lot of the reason women will crave chocolate leading up to the start of their menstrual cycle is because they are actually deficient in magnesium. Magnesium is a muscle relaxant. So when you get your period, your uterus contracts, and that could be quite painful, especially if you're deficient in the mineral magnesium. So again, we need our gut working optimally so we can absorb these nutrients through our food. In practice, what I see a lot with patients, I get this often, when we do lips, we're very much known for our lips. And my patients will tell me that some days I wake up and my lips are tiny, and some days I wake up and my lips are plump and I don't think I need to do them. And today they're plump. So I booked this appointment, but I'm feeling good about them. And this is where the education comes in and around the menstrual cycle, that when you are in and around ovulation, you are more flush. Your lips are more hydrated. That's an estrogen thing. That's estrogen that makes them plump. And this is why our lips get smaller with age, is because our estrogen levels decline naturally and your lips shrink up a little bit. So that's why sometimes when people do filler, we're not adding a lot, we're just adding a bit, bring back a little bit of height to bring back a little bit of that youthful look. So again, different parts of your cycle, things change, skin elasticity, like you said, hormones play a big influence on how dry our skin is, whether or not we're experiencing a breakout. So like I know for me personally, when I do content with my marketing team, I try to book it around a certain time in the month where I feel and I know I look my best. Because when I feel really good, I feel like I do better in practice, in life, everything else. I have also accepted that at certain times in the month, I take a step back and I don't overexert myself.
Yeah.
And maybe I'm not going to be on social media as much, for example, and I hide out a little bit more. And I'm okay with that because I understand my cycle. Now, this may lead into our next question, but this is very relevant and important to talk about nowadays because so many women are on the birth control.
Yeah.
Now, being on the birth control, you're not having a true cycle. You're having, like if you do still bleed on the cycle, that's what we call a breakthrough bleed. And funny fact, I was listening to a podcast last week, and the man that invented birth control wanted to still give women the illusion that they were in control of their cycle.
Yeah.
So he made that sugar pack week and the estrogen pills. So when the women take the sugar pills, they get what we call a breakthrough bleed. It's not a true period, but it kind of gives them the impression that they're having a period, which in fact they're not. So when it comes to treating hormones, tell me about the difficulties you face in your practice when a woman is not ovulating, when she's not getting a regular period, and then like what deficiencies come along with that? What challenges come along with that when you're trying to balance their hormones?
Yeah. Oh, yeah. Even what you just said about the breakthrough bleed and giving kind of that illusion of control around the cycle. I was just thinking about how oftentimes when somebody does go to a doctor with cycle irregularities, they will be prescribed birth control. And it gives them that thought that, yes, this is fixing things because I'm getting a period regularly again. When in reality, it's oftentimes putting a bit of a Band-Aid on top of what's going on underneath the surface. So some of the challenges that come up when we're not having a regular cycle, number one, how do we feel? Right? When I was talking earlier about when we ovulate and then we notice our progesterone increase, our luteal phase is when our progesterone is a little bit higher, and that's about 2 weeks. And so if you are menstruating and then in your follicular phase at the beginning of your cycle, and then you're in the luteal phase at the second half of your cycle, 2 weeks is a long time. That's half of your life if you think of how many periods that you have. Half of your life where you are experiencing intense bloating, changes in your bowel movements, changes in your mood. You might even go as far to being diagnosed with PMDD, premenstrual dysphoric disorder, which is an intense level of depression and mood changes associated with your cycle. So if we think of half your life is centered around not feeling well and trying to make accommodations for your cycle, that's a lot of energy and time being put into cycle management and symptom reduction rather than living your life and thriving and being able to do things that bring you joy. You might even be diagnosed with PMDD, which stands for premenstrual dysphoric disorder, which is essentially a condition in which you experience really intense depression around your luteal phase, and you might experience a lot of anger as well. So that's the majority of your life. It takes a really big toll on our mental health and on our physical wellness if we are always worried that when we enter into that luteal phase, we're going to get migraines and our quality of life is going to significantly decrease.
So I can see the importance of using a birth control if the quality of life is that poor and if there's risk associated with the low mood. I understand that. But is it not just inevitable? You're going to have to face it eventually because it is a Band-Aid solution. So my concern is with these young women that do have these imbalances, not understanding that there is help in and around balancing out your cycle so you can gain quality of life back versus going on a contraceptive solution that's not only masking the issue and then you want a family plan later on, you're 34 years old, you're coming off of a birth control that you've been on for 10, in some case 20 years. So you even have more healing to deal with. I guess that's my biggest concern is just spreading the word that there are alternatives, that is not the one and only solution, because it's not a solution, period.
Mhm.
Birth control is not a solution. It is masking the symptoms. And then it's also taking away the quality of life when it comes to fun things in your cycle, like in and around ovulation. When a
Mhm.
woman's ovulating, she feels good.
Yeah.
Estrogen is very anti-inflammatory. It makes you feel healthy. It makes you feel like you can conquer the world. Your testosterone's also as high as it's ever going to be during
Yeah.
that point in your cycle. You look good, you feel good, you have a libido, you challenge yourself on a different level. And then when you are on something like a birth control and you're not ovulating, you don't get to experience those things.
Mhm.
And I think especially any woman, any age should know what it feels like to feel those ups and downs during their cycles, be in tune with their body. So how do we get the word out there that there are other options than, to help these conditions like PMDD, extreme PMS, than just here's a prescription for birth control?
Yeah. I think that teaching women how to advocate for their health in a doctor's office is so important. So, one thing that I recommend to all of my clients is to create a binder with their symptom history, all of their medical history, their family medical history,
Mhm.
and any lab testing that they've done in the past. So, when something comes up for them, or when they want to make a shift with a medication, they can go to their doctor. And if their doctor says, well, I don't think that's a good idea, they can flip to their catalog page of, and I have been experiencing these symptoms for the past X amount of days. I would really like you to address this because of XYZ reasons. This is how this impacts my quality of life. And if the doctor refuses to support them with that, ask them to chart it, because if there is something that is being masked and that is not being addressed, that is potentially a much larger health condition in the future, that is then on that doctor.
Brilliant.
Yeah. So it's really,
Brilliant.
really important to be able to advocate,
Mhm.
which is not always easy, but
Mhm.
tools like a binder can be extremely supportive for that.
Mhm. That's important. I never even thought of that. When I discuss this with my patients and they're going to see their medical doctor, we do talk about symptoms and things that need to be brought up at the appointment so they can get the adequate help they need. But I know that there's a lot of intimidation,
Yeah.
especially a young woman going in and her mood is low and she's struggling. There's a lot of intimidation when it comes to that setting. So I do the same where, I teach them how to advocate for their own health,
Mhm.
right? In Canada, we pay into a healthcare system. So this is what gives us the medical attention when we need it.
Mhm.
And we need it. If our mood's not optimal and if our quality of life, like you said earlier, that's half of your life, 2 weeks out of every cycle is half of your life. If it's that low, yes, you need support.
Mhm.
Yes, you need help building that back up again. So
Mhm.
shouting from the rooftop, there's other options to help with balancing hormones. Birth control is not your only solution, nor does it have to be. When it comes to treating and balancing hormone health, I know that I see a difference in as little as 3 to 6 months when we have, patient client compliance. They're following maybe a nutraceutical program, maybe, addressing environmental exposures that may be affecting their health and, taking a holistic approach. I do find that we can make big changes.
Mhm.
Now, do you see that a lot in your practice?
I do, especially with PMS. Supplementing certain different types of vitamins and minerals can be extremely helpful, even
Mhm.
symptomatically, while we work on what might be influencing things under the surface. So, for example, magnesium and B6 has been shown to be incredibly supportive for premenstrual cramps. So, if your cramps are something that cause you to stay in bed for a week out of the month or a couple of days out of the month, or you have to skip social functions because you feel like you're doubled over in pain, something like magnesium and B6 might be the door for you to be able to get out of bed and create more social connection while you start to make those environmental changes.
Mhm. Okay, and so that's how you individually help them is you find those deficiencies, you find those environmental factors that may be playing a role and help correct them. Now, I find that when it comes to low mood, depression in and around the period, painful periods, I feel like those are the most compliant individuals because it does affect your quality of life.
Mhm.
Environmental medicine. Let's discuss environmental medicine because I know I go on topic about it a lot. I would love to hear what you believe are the top. And this is a very broad question, but if you could narrow down for me the top maybe 4 or 5 endocrine disruptors. And what I mean by endocrine disruptors are things in your environment that negatively impact the health of your hormones. What would you say the 5 biggest culprits are?
Yeah. Okay. So, two ones off the top of my head would be phthalates and BPAs.
Okay.
So, when you think of those substances, they're in a lot of plastics. And you can think of phthalates as it's a chemical that makes things really malleable. So, it would be in like your soft water bottles. It's also in makeup to make sure that your makeup doesn't separate. And phthalates and BPAs are really important to be aware of because they absolutely affect our endocrine system. So we notice that there are shifts and changes in testosterone. We notice that there are changes in the function of the thyroid. So when we think about, like when we zoom out and think about hormone health, we're talking about supporting people with fertility. We are talking about supporting our clients with having a better quality of life. So if you have a sluggish metabolism because your thyroid is not functioning properly, changing the things that you put on your body or put in your body can be a massive component of shifting your metabolism and increasing your energy, making it so when you wake up in the morning, you are not feeling sluggish and tired as you get out of bed. When we talk about removing things that impact our testosterone, we talk about impacting sperm count. Our sperm count is decreasing by, I think, about 2 to 3% per year, which is a lot. So when we talk about supporting people in getting pregnant, it's not just actually women that we want to focus on. We also want to focus on men as well.
100%.
So those are 2 really big ones. Flame retardants are also really big. So those are in a lot of clothing. So that's one to be really mindful of.
Fast fashion. Right?
Yes. Absolutely. So really good quality textures, things that are going to last a really long time. I think a lot of people are getting into making like a capsule wardrobe nowadays. So not shopping with fast fashion can be extremely supportive. PCBs are another one. So those would be in like a lot of old school paints. So if you live in a house that has very old paint, that would be something to be aware of. And then pesticides. Pesticides are huge. So in an ideal world, we would say, yes, eat organic all the time. And also that can be really expensive and challenging for some people. So I would recommend looking up the Dirty Dozen and the Clean 15, making sure that if you are not buying something organic, you are washing it very well, making sure that you are potentially even cooking it down. And if you are buying organic, still making sure that you wash your produce, because organic doesn't necessarily mean that you aren't getting anything on the food that you're consuming.
Okay, those are all really big endocrine disruptors and ways to mitigate it, like plastic, avoid it as much as you can. I know, for example, like hard plastics, I do use hard plastics. I don't put them to the dishwasher. I don't expose them to heat because over time they do leach, especially when they've been warmed up time and time again. Avoiding things like receipt papers. I'm sure you've seen on social media, the big one, the plastic in cans. That was a big one for me. I love having like something soda, like carbonated, well, not soda sugar, but like carbonated beverages in a can. And just the BPAs you're getting from that alone was a huge eye opener for me. So what about the other ones? Other than you said the food, you explained that, but what do you use for makeup then? That's a big one that we apply every single day.
Yeah, makeup's a hard one. So I actually recently downloaded an app called Yuka, and I love it. Yeah, it's so great because it allows you to scan any of the products that you're using and understand what's in it. It'll give it a really easy color rating. If it's green, it's good. If it's red, it's bad. So you know what you can switch out and what is really necessary to switch out and what is more that you can keep in. So makeup's a hard one though, because like everything that you put on your skin that you will find in the drugstore will have a lot of these endocrine disruptors in it. So it's challenging for me because there's certain makeup that I really enjoy and really like, and it has worked for me for a really long time. So that was one that I went, okay, this is a big one for me to tackle. And so I'm going to put this on the back burner, and I'm going to look at what are all the other things that I can approach in my life first. Because I can switch out my deodorant, or I can use just glass containers instead of plastic, or I can make sure I don't heat something up in plastic. Looking at natural deodorant is a big one. That can be challenging as well because sometimes natural deodorant isn't the most effective. Not using things like plastic wrap is really helpful. So really looking at every little aspect of what you're putting in your body and what you're putting on your body and what is in your environment is helpful when it comes to working with endocrine disruptors.
And balance at the end of the day, because you're not going to be completely void and free of all toxins walking down the street. Your fuel that's going to affect the health of your hormones. So not overthinking it, but just being mindful when you can be mindful, and then maybe working with a practitioner to help keep balance in tune, right? Because like I know one of the big practices in mine is I know I have BPA exposure. We all do. I make sure I sweat regularly because they can actually measure BPA through your sweat, which is quite fascinating. So there's lots you can do. It doesn't need to be, you don't need to overthink it, but you need to make mindful decisions, especially if you really want to start working on the health of your hormones. Would you agree?
Oh, yeah. And thinking about what we can do to support detoxification, like you were talking about sweat. So sweating is really important, making sure that you're having a consistent bowel movement every single day so you're not constipated and holding all of these things in your body, making sure that you're hydrating your body, you're getting adequate minerals in your water. All of those things are really important and can really help with reducing our exposure once we are exposed to the things.
Okay. A lot of upsetting talk around hormone health. But let's end this on a positive note, because there's so much I know we can do, especially for women when it comes to having painful periods, having mood disorders leading up to their cycle. Now, in practice, how do these women find you? Where do they start? What does a treatment plan look like? What is the outcome? How many months? And is there such thing as a pain-free period?
Okay. So the last one I will answer first, and there's absolutely such thing as a pain-free period. Most of my clients will find me either via referral or on Instagram or on Facebook. I also have a website, which is therootedmethod.com. And my clients can work with me either as a counselor, and that would be a counseling container, and we'd work just in counseling, or as a nutritionist. So depends on what they're maybe needing a little bit more support for. When it comes to what a treatment plan looks like, it's really that phased approach. We take things quite slow, oftentimes at first, because one step at a time is better than 10 steps and then getting overwhelmed and having the ball kind of roll back down the hill. I would say when it comes to noticing really great results and changes in our overall wellness and with our cycle health, about 3 to 6 months is the average timeline that we notice with people. However, I always say to match your expectations to the amount of energy that you have to put in. Because if you want to start on a program to manage your wellness, but you have so much going on in your life that even making really small shifts in your diet is going to feel super overwhelming, then that might not be a realistic timeline for you. That's not to say that it won't ever happen. It just means that maybe it might take a little bit longer. But every little thing that you do can be incredibly supportive. And even if you're taking one step forward every single day, that adds up over the span of a year, 2 years, 3 years into the future when you're looking to get pregnant and have a baby, if that's something that you choose to do, and you're not struggling with your fertility. Or you go into menopause and it's not such a roller coaster for you. Things are more regulated because you've supported your gut and you don't notice such a wild fluctuation in the way that you feel on a day-to-day and your mood as well.
Okay. So just emphasizing it's a journey.
Yeah.
The change is going to come over time. So it's always good to reflect and there's going to be ups and downs, but as long as we're on that incline, we're going to get there eventually. So I know you have a workshop coming up in September. Can you tell me a little bit about that?
Yes. So my workshop is called From Trauma to Tummy, and it is the integration of the mind and body all in one. So I have a co-facilitator named Katie, and we really wanted to come together to support individuals in looking at how trauma impacts our digestive system and any kind of chronic health issues that we've experienced in life, as well as look at functional ways that we can support our digestive system on a day-to-day basis. So it's 2.5 hours. We're going to take our guests all through the nervous system, how to support the nervous system. They're going to walk away with somatic tools for stress. And we're also going to teach them about how to recognize imbalances within their digestive system and support imbalances within their digestive system. So very all-encompassing. And we really just wanted to create a platform where we supported individuals in taking a deeper dive into their health and understanding what's underneath the surface.
Awesome. It's a great place to start when you're exploring your health. Now, I'll put it in the show notes, but where can we find you on Instagram and what's your website?
Yeah. So my nutrition Instagram is _Chloe Catherine. So that's just my name. And then if you wanted to learn more about the counseling aspect of things, it would be at The Rooted Method Counseling. And then my website is therootedmethod.ca.
Okay, awesome. Chloe, that was fun. I could talk to you about hormone health all day. There's so much more to it. I'd love to have you on a future episode and we can take a deeper dive into some more specific topics. So thank you for sharing your morning with me. I really do appreciate that. And to all my listeners, you can support us by giving us a follow on Spotify and YouTube. Check out our Instagram page and be kind to yourself and kill others with kindness.